All, this is Dr. Mubin Sayed. Today we're going to continue with our discussion about the tapeworms. Today we'll talk about Taenia Saginata. Taenia Saginata is a tapeworm that usually uses kettles as an intermediate host. The definitive host still is human beings. So that means we acquire this from beef instead of from pork. So let's look at the references quickly and then we'll look at my drawings. So this is drbeen.com. If you do not have access to this, go to the plans and get access, or you can even find a link in the description of this video. This is CDC on taeniasis. We'll talk about that. This is another link about the life cycle of parasites, especially Taenia Saginata. Then this is taeniasis resources. This is the tapeworm infection and the management of it. This is a interesting document by FDA about the praziquantel. And then finally, this is ivermectin. Somebody was asking me last time that is ivermectin not useful for Taenia or these tapeworms, and the answer is no, it is not. So here is a study about that. So with this, let's actually start with my drawings and we'll go from there. So Taenia Saginata or beef tapeworm, it has the exactly same life cycle as Taenia Solium as we discussed yesterday. The only important thing is that when humans eat egg or ingest eggs for some, accidentally of course, they do not develop cysticercosis. That is a primary difference. We do not develop cysticercosis from the Taenia Saginata, while we can develop cysticercosis from Taenia Solium. So this pathogen and its tiny early life form, the baby form, the naive form, does not make cysts in our tissues, but it does do that in the intermediate host. So that is a basic primary difference. So two categories of diseases: taeniasis, that is infection by the adult worms, and that would happen in the humans, and cysticercosis. In this special case, this would only happen in the intermediate host, for example kettles, and that would be because of the infection by the young worms. And over here we have the egg that we discussed yesterday as well with Taenia Solium. This egg has the innermost structure here. This is the embryonic egg which is fertilized. So if you see here, there are some hooks and then there are glands that would help this pathogen break down the tissues when it will be tunneling through the tissues of the animal. Then the egg of course has some coverings around this. This whole structure is called oncosphere. Now two host types as well: definitive host and intermediate host. Intermediate hosts are the hosts where the early life form of this pathogen or parasite will live. So these hosts harbor immature parasites. The definitive host for the tapeworms in general are humans, although an animal can become a definitive host as well, but usual definitive host for these tapeworms are human beings. So here, definitive host is where the parasite reaches its adult stage and lives there. Structure very similar to yesterday. It is also a tapeworm. That means it has a scolex, or the head area would have some hooks on it, and then it would have suckers with which it will actually create a vacuum-like structure and bind to our intestinal cells, especially upper intestine, jejunum for example. Then it would have a neck which is relatively segment free. Then it has the body which is a segmented body. It has many box-like segments. Remember, it is a flat worm, so those boxes are kind of flat boxes, and this whole body is called strobulus, and these segments every individual segment is called a proglottid. Now within the proglottid, as the proglottid start maturing, each proglottid has a complete reproductive system in it. That means it has a uterus, it has a vagina, it even has a sex spore, that means it can do cross fertilization, it has testes with the sperms in them, it has ovaries with the ovas in them, and it even has a yolk sac. So this whole structure is present in every mature proglottid. The other thing that is interesting is that the whole worm does not have a digestive system. So it would receive nutrients by absorption from the intestinal environment. So all it has to do is its head has to just get bound somewhere in our jejunum, in our upper intestine, and just get anchored there and stuck there, and then the food that we are eating, this worm would start absorbing that food and nutrients from it, and that is what would make it grow. And as I said before, it can usually grow to 5. It is one of the largest tapeworms in our bodies, up to 5 meters, but this can even be 10 meters. So yeah, I'm not talking about centimeters or millimeter, 10 meters. And 25 meter samples have been found in humans as well. Now the last portion, the oldest segments, will start detaching from the worm, and they would be shed in fecal matter. They are actually visible in the fecal matter. So that is a visible symptom of the taeniasis, or the infection with Taenia or tapeworms. Eggs can also be shed, those oncospheres. So there can be proglottids which are gravid. Gravid means pregnant, and there can be eggs as well. They can be a mixture of both present on the stools as well. Now the definitive host, this was the structure of this pathogen. How does this pathogen end up in a definitive host, let's say a human being? So what happens is that the human being is going to eat the meat of the intermediate host, for example, a cow, and that meat would contain the cysticercosis, or those little cysts of the pathogen, which are not formed in human beings, but when the intermediate host eat them, they form those cysts, and we would discuss that in detail later on. But just at this time, please go with me that in the intermediate host, for example, the meat of the cow, the muscle contains lots of tiny cysts which contain the early life form of this pathogen. When we eat that, what happens is that within our intestine, we break the structure around the cysts, and the actual worm, the head and the neck, they become everted. So the cyst becomes everted. The pathogen is actually in it. Let me actually go to a diagram. So here, this is a cysticercosis. This is what is present in the muscle of a cow, for example. And here, if you see, this is the animal, this is the worm in here, this is the head area of the worm, and this is the neck. So we say it is sitting in the cyst inverted. And when it is ingested by us, this little head and neck would actually then become everted. It would come out and bind with our cells. So now if I go back here, as the cysticercosis are present in the undercooked meat, we eat that meat, we end up with the cysticercosis in us. That would reveal the protoscolex, that is that little head that I showed you. That little head, if you see here, that is bound to the villi of our cells, mostly the jejunum and the cells of the jejunum. It is now bound there with the suckers it has. There are 4 suckers on its head. Once it is bound there, then this little head and little neck would start absorbing the nutrients from the food that we are eating. That would allow it to start forming its strobulus, or the body. The body is really a lot of proglottids. In the case of the Taenia Saginata, or the beef tapeworm, there can be 2,000 segments and 10-meter long worm present in our intestine. So it would mature in 10 to 12 weeks, so 2 to 3 months. It can live in humans for 2 to 5 years or more as well. The beef tapeworm can up to 10 meters. Gravid proglottids and eggs are shed in the fecal matter. So here, this beef tapeworm would actually be connected to the jejunum, and then it would just be present inside our intestine. I made it on top of the intestine, but this is actually within the intestine. And it is eating and stealing our food. That is why we would actually start losing weight while this thing is growing. Now, when the definitive host has this worm matured in it, then the fecal matter would have the proglottids and oncospheres on it. When a cow eats that or cattle eat that, so here we're not talking about pork, that is your first difference of Taenia Saginata from Taenia Solium. So when a cow would eat this proglottid and oncosphere, then what would happen is now we are within the cow's intestinal system. So imagine that this is the oncosphere that the cow has eaten. This oncosphere would be broken down by the digestive enzymes of the cow's intestinal system, which would then release the little parasite, which is just the head and neck with some structures that would allow it to tunnel through the tissue and end up in the cow's lymphatic system and the blood circulation system. From there, it would end up in the cow's muscle or other soft tissues, for example, liver, brain, spinal cord. So that would be called cysticercosis, but that is happening in the intermediate host or the cow. Now, this is the cysticercosis that I said. Cysticercosis is really a bladder-like structure that fills with fluids, and the pathogen is present in here. The pathogen can stay in here alive for 2 to 5 years, and then it would start dying. Even 10 years, it continues to grow in there, and then it dies. When it dies, the cyst breaks, and the fluids and the broken pathogen comes out of it, which will then cause, wherever the local tissue it was present, the cyst, that would cause local inflammation. In case of the brain, if it is present, for example, Taenia Solium is present in our brains, it could be present in our brains, and when those cysts break, that can cause brain tissue damage. This is why if somebody has epilepsy or seizures, we should be very careful for treating them with antiparasitics, because if their epilepsy and seizures are because of the Taenia Solium, today we're talking about Taenia Saginata. So we're talking about yesterday Taenia Solium or the beef tapeworm. If they have cysts because of the beef tapeworm, then what can happen is that these cysts would burst open because of the treatment, and that can actually cause severe symptoms of seizures and epilepsy and can become even life-threatening. So we have to be very careful. So back here, this cysticercosis is present in the animal. So now this is the cysticercosis, the brain of the animal, eyes, muscles, liver, etc. can have these cysts in there. Now what happens is, going back to the definitive host, when the definitive host or a human being eats the meat, let's say undercooked meat of a cow which has the cysts of the Taenia Saginata in it, those taenia would enter our GIT system. So here they are within our GIT system. Over there they would evert from the cysticercus, and they would then anchor with our intestinal cell, and then they would start growing. So as they grow, they would become, as I said before, long worms, which would mature into adult worms, which would then have proglottids, the proglottids can self-fertilize or they can cross-fertilize. At the end of the day, there are oncospheres, which would then be shed in the fecal matter. Now the animals that are grazing in the contaminated spaces with the human fecal matter, those animals, those cows, those cattle will become sick with the cysticercus, and that is how the cycle continues. Now the clinical presentation or taeniasis. So Taenia Saginata is more frequently symptomatic compared to Taenia Solium. If you remember yesterday's talk about Taenia Solium, I said that many times it is asymptomatic. There are no symptoms that appear. Taeniasis, not cysticercosis. But Taenia Saginata can actually produce symptoms more often compared to Taenia Solium. Typical symptoms are epigastric discomfort, nausea, flatulence, diarrhea, or hunger pains. Most visible symptoms is the active passing of proglottid through anus and in the feces. So what I did was I took these symptoms on the CDC side just so that we have the most up-to-date information. Today is May 10th, 2024. If these information change, which I don't expect that the clinical presentations would change, then we would update this lecture. But for reference, this is CDC. Rarely, proglottid can lodge in pancreatic duct or appendiceal lumen. So appendix or the pancreatic duct can have the proglottids that can get stuck in there. And most of the time the symptoms would appear after a few weeks, so that because the worm has to become mature and long enough to start producing these symptoms. The diagnosis. Again, if you see here, this is CDC. I intentionally, deliberately took the information from these sites because they would have those information that are part of the protocols for management and diagnosis, and this might change. This is what we have today. Microscopic identification of eggs and proglottids in feces is diagnostic for taeniasis. However, eggs and proglottids are not released into the feces until approximately 2 to 3 months. That is the time when the proscolex, so that tiny head and neck, would start becoming grown and grown after taking nutrients from us, and they take 2 to 3 months to become an adult worm. That is when you can diagnose it, and that is when they would create symptoms as well. So 2 to 3 months after the adult tapeworm is established in the upper jejunum, repeated examination and concentration techniques will increase the likelihood of detecting light infections. Examination of 3 stool samples collected on different days is recommended to increase the sensitivity of microscopic methods. Eggs of Taenia saprophyticus cannot be differentiated. A species determination may be possible if mature gravid proglottid or more rarely examination of the scolex are present. What they're talking about is we have many kinds of tapeworms, and just from proglottid differentiating them becomes difficult. Recently developed copro, antigen, and molecular assays are more sensitive than stool examination, but these assays are not yet available outside of the research labs. Serological methods, which are available only in research settings, may be used to identify Taenia Solium tapeworm carriers. So they're talking about Taenia Solium over here, and generally we're talking about taeniasis with Taenia Saginata. Many of these are diagnosed with the same way, then differentiating between them becomes a problem. Now, management. Similar management for all taeniasis or tapeworms, and that is the praziquantel, nicotinamide. So here, this is WHO. Taeniasis can be treated with single doses of praziquantel, 10 mg per kilogram. Actually, CDC says 5 to 10 milligram, but then the CDC says that 5 milligram is not as efficacious as 10 milligrams. So here, WHO just says 10 milligram per kilogram. Or nicotinamide, adults and children over 6 years, 2 gram, children aged 2 to 6 years, 1 gram. Albendazole at 400 milligram for 3 consecutive days is also used. Now, this is also treatment of Taenia Saginata, but this is from CDC. Praziquantel is the medication most often used to treat active taeniasis, given at 5 to 10 milligram per kilogram orally for adults and 5 to 10 milligram per kilogram orally once for children. Once. Available evidence suggests that using 10 milligram per kilogram once orally may have a higher rate of cure than the 5 milligram per kilogram. That's what I was just talking about a minute ago. Nicotinamide is an alternative given at 2 gram orally once for adults and 50 milligram per kilogram orally for children. Albendazole, given at 400 milligram daily for 3 days, may be used as another option for the treatment of taeniasis, although this is based in studies for treating small number of infected individuals with Taenia Solium or Taenia Saginata. Stools may be collected for 3 days after treatment to search for proglottids or scolices. Scolices are the head. Species identification. If necessary, stools should be re-examined for Taenia eggs 1 to 3 months after the treatment. So the reason is that if there is some heads that are still stuck, they might take another 2 to 3 months to once again develop into worms. So you should check the patient 2 to 3 months later. Now, both praziquantel and albendazole should be used cautiously in patients suspected to have cysticercosis. So remember I said that before, cysticercosis could be in the brain of the patient. Again, not in the case of Taenia Saginata, but in the case of Taenia Solium. They have a combined treatment plan over here. That is why they are covering both once more. So the Taenia Solium, if that is the case and you are treating the patient and the patient may have cysticercosis, they might develop severe symptoms when the worms and the cysts start breaking apart. So there are case reports of seizures that may have been temporarily associated with the treatment. Oral praziquantel is available for human use in the US. Nicolosamide is not available for human use in the US. Oral albendazole is available for human use in the US. Now check this out. Praziquantel and albendazole are not approved by the US Food and Drug Administration for the treatment of taeniasis. So that means this usage is going to be off-label. Now the FDA, Central Nervous System, so this is the trade name of the praziquantel, so I'm not going to say the name, you can see it, but we are talking about praziquantel. It's a CME lecture. So praziquantel can exacerbate central nervous system pathology due to schistosomiasis or other, including Taenia Solium. So once again, today we are talking about Taenia Saginata. So this is really just Taenia Solium, but I think it's interesting to keep it in mind. As a general rule, consider whether to administer praziquantel to an individual reporting a history of epilepsy and or other signs of potential nervous system involvement, such as subcutaneous nodules, etc. So just be careful. And so that is the discussion. This pathogen, once again, is present wherever animals are concerned, wherever hygiene is not good, wherever human fecal matter is scattered on the surfaces where the animals are grazing. That is where this can happen. The only good news about Taenia Saginata is that if a person ingests the oncospheres or eggs or proglottids, they do not get infected, while if they do ingest the cysticerci from the muscle of the animal, then they can develop taeniasis or the tapeworm infection. So that is the discussion. Please like, subscribe, and share, and I would see you again. There are a couple of more tapeworms that I want to make sure that I finish them, so this tapeworm or worm-related set of talks is completed. I would see you after that. Thanks. Bye for now.